Hi friends, welcome back to my channel. My name is Aina and I am an oncology pharmacist. Today I have gathered 15 of the weirdest side effects you can get from prescription drugs. Some of them are so weird, I thought the textbooks were exaggerating when I learned about them, until I meet patients in real life that tell me that they had them. But some are side effects that I might actually want to get. I know that's probably shocking to hear, but you'll find out why. And I'm going to rank them on a tier list. F is obviously, these are the worst side effects you can get, all the way up to S tier, which are the side effects you might want to get. So we're gonna go from head to toe. And the first weird side effect, we're gonna start from the hair. And that's curly hair after getting chemotherapy. Now this is probably the strangest, yet least talked about side effect after chemotherapy because, well, there are just so many more worse side effects when someone goes through chemo that this has just kind of gotten left behind. So we all know that some chemotherapy causes hair loss, right? So the patient will go through a few months of chemotherapy, they will lose their hair, and after they finish their chemotherapy and all the drug has left their system, their hair will actually grow back. However, the hair might actually grow back differently. A lot of people notice that it grows back curly, and a good example is Hank Green. He went through treatment for Hodgkin's lymphoma, which I actually made a video about, which I'll link down below, and after that, his hair came back curly. So far, there's not much science to explain why this happens, but we know that both the color and the texture can come back different. I remember working one time and I was checking this patient ID and I was looking at her photo in the ID, and when I looked up at the patient, I almost couldn't recognize that this is the same person because her photo on her ID was obviously taken before chemo, and she is here in front of me after chemotherapy. In the photo, she had straight and dark hair, and in real life, she had curly and light colored hair. It was so bizarre. So I think this one is quite neutral as a side effect. I mean, some people might like their hair less after it grows back. Some people might like it better. So I'm just gonna put it in C tier. C for curls. Okay, now we're gonna move down. Going to the brain, we have sleep living. Why did I call it sleep living? Because it can be sleep anything, like sleepwalking, sleep driving, or sleep having sex. When we learned about it in school, we just gave this an overall name called complex sleep disorder. But what's worse is that the patient usually has no memory of anything. They don't remember what they've done, or that they even did anything during their sleep. Now, you might find this one funny, but it's actually not. There have been actually more than 20 cases of recorded death and at least less than 50 cases of injuries due to this side effect. I'm reading this one study right now and it has recorded cases of fatal carbon monoxide poisoning, drowning, falls, motor vehicle collisions, and apparently suicide. And this all happened while the patient is sleeping. And the most ironic part is that these side effects are caused by a class of drugs that's used to treat insomnia. The two common ones that we have in Canada are called zopiclone and zolpidem. And I do see them prescribed a bit too casually to help anyone trying to fall asleep, especially in the elderly. Now, the chance of having this side effect of sleep living is low, so I'm not trying to scare everyone away from these drugs. They are effective and they do have their places in use, but I'd have to rank this side effect F tier. This is way too scary. Alright, we're still in the brain, and the next weird side effect are abnormal dreams. Now this one is super interesting because some of you might think this is a good thing, right? I'm gonna get Inception-like dreams with all the world building and cool actions, right? But in reality, it can cause nightmares. And this can be caused by several different commonly used drugs, actually. One of them is called Effexor with the generic name venlafaxine. It's a pretty commonly prescribed antidepressant. It can cause abnormal dreams in about 3% of all patients. And also, those sleeping pills that I talked about earlier, they can also cause abnormal dreams. I personally have very vivid dreams even without being on any medication. I think a really weird one that I had recently was I entered into a battle royale island just like the one in the movie Battle Royale. I had to fight for my dear life and then I was eventually killed. But then I became omniscient and I gained this third-person POV and I continued to watch the rest of the fight play out. I think I would rank this one in B tier. It's not the most horrible side effect you can get, but it does affect someone's sleep quality, so not the best either. Next weird side effect. We're still in the brain, guys. I guess a lot of these drugs really mess up with the brain. The next one is called impulsive behavior. And we're talking about really strong urges here, like the urge to gamble, binge eat, or really strong sexual urges. I personally think this one is extremely scary because you've basically lost control of your body. We've given this type of side effects an overall name as well called impulse control disorders. And we find that it most commonly shows up as gambling. So some of the common drugs that can cause this are Abilify, which is an antipsychotic called aripiprazole, or Parkinson medication like Sinemet. The reason why these drugs cause the urge to gamble or binge eat kind of makes sense though, because these drugs work on the dopamine pathway. As we know, dopamine is the happy chemical in our body, right? The higher the dopamine, the happier you feel. So dopamine activity works in the brain's reward pathway. So if that gets messed up, you'll end up with these really crazy, uncontrollable urges. I personally think anytime you lose control of your body, it's really bad. So this is going down to F tier as well. Now we're gonna move down to the eyes. And the next weird side effect is change in eye colors. Yes, that's actually a thing. There's this eye drop that's used to treat high eye pressure or glaucoma in patients, and the eye drop is called latanoprost. It can increase the brown pigmentation in the iris, which is the part of the eye that gives its beautiful color. So if people with other colored eyes like blue, green, hazel, after using this medication, they can all turn brown. So people with brown eyes to begin with, like me, probably wouldn't notice a difference. But those with lighter pigments to begin with, they might permanently see this change. So this one isn't really a life-threatening side effect, and it doesn't really cause any pain or anything, but I would assume that not everyone wants their eye colors to be changed. So I'm gonna put this one in C tier. C for color change. All right, next one, we're still in the eyes, and this is the side effect that I said I actually want to get. And the reason is, this side effect is longer eyelashes. I'm 100% serious. There's a drug that gives you a side effect with longer eyelashes. And it's the same drug as the previous one, latanoprost. Not only can it give you longer eyelashes, it can also increase the number of eyelashes, so more volume, and it can make it darker. That just sounds like the most effective mascara out there. And it can happen fairly commonly in over 10% of the people using this eye drop. But before you rush out there and buy this for your eyelashes, know that this drug causes other side effects as well. Things like eye irritation, pain, redness, and these side effects are a lot more common than the eyelash side effect. Plus also, this is only prescribed for people with glaucoma. But in terms of side effect tier list, this has to be S tier. Like if I'm gonna get any side effect from a drug, I want my eyelashes to benefit. Now moving on, we're still in the face area, but we're gonna move down to the mouth. And this weird side effect is hairy tongue. And unfortunately, I've had personal experience with this one. It sounds horrible, and it actually is more horrible than what it sounds like. This is a very signature side effect from a class of antibiotics called tetracyclines. And also the main ingredient in Pepto-Bismol, which is called bismuth salicylate. And I unfortunately was put on a treatment with both of these medications. I'm gonna insert a photo here, but it's a little bit gross, so if you're squeamish, make sure you skip ahead a few seconds. So the black, hairy-like stuff growing on your tongue is actually from your tongue itself. So your tongue has these little pink protrusions on them, right? That's why they're a little bit bumpy, and those are used to grip food. Once they grow to a certain length though, they actually die and they will shed away when new ones come out. But when you're on these drugs, they actually mess up the mechanism of this, so your tongue ends up having these black, hairy-like stuff. The good thing is though, once you're done with the medication, this side effect goes away, so thankfully my tongue returned to its normal self. I really want to put this one in F tier because it was just so disgusting, but because it's not really life-threatening and it goes away on its own, I gotta be fair and just put this one in C tier. Alright, last side effect in the face area, we're gonna talk about hirsutism, which is a fancy word to describe excessive hair growth in women in places where usually only men would have hair. For example, a beard, a mustache, chest hair, or belly hair. This sounds extremely strange, right? But this can actually happen when there's too much male sex hormone in the female body, something called androgen. Just because it's called male sex hormone doesn't mean only guys have them. Women have them too, but normally just in lower amounts. However, when these women are put on medications that increase their androgen levels, they end up getting these male characteristics. Some common drugs that can cause this are Rogaine, which is minoxidil used to treat hair loss. I know most of the time men use this, but women can use this too. I talked about this drug in my reaction to the Trash Taste Balding episode, so I'll leave that link down below if you want to check it out. Corticosteroids like prednisone can also change the androgen levels in your body. You might have even been prescribed these drugs after dental work because they're usually used for pain and inflammation. Good thing is that this is reversible, so once you stop taking the medication, this side effect will go away. But it's definitely a very undesirable side effect, and especially if you're someone that has to be on this medication long term. And it can cause a lot of anxiety about physical appearances in these patients, which I can totally understand. So this one is gonna go into D tier. Alright, we're moving away from the face now, and we're gonna go down to the chest and talk about this side effect that, medically speaking, makes a lot of sense, but physically, I think it's really weird. It's something called Galactorrhea, which means flow of milk from the breast that's not related to childbirth. So basically, lactating when you haven't given birth to a child. And this can happen in both men and women. Why do I say scientifically this makes a lot of sense? Well, milk production is directly linked to this hormone called prolactin in your body. So if you have high levels of prolactin, you produce milk. If you have low levels of prolactin, you don't produce milk. There are certain drugs, and these are some very common drugs. For example, like antipsychotics, like Risperdal, also known as risperidone, or Abilify, also known as aripiprazole. They can increase prolactin levels and cause milk production. The only ways to treat this is either you change your medication or you have to go on other drugs that decreases your prolactin levels. So I would put this one in D tier for sure. I can't imagine how uncomfortable that must be. Alright, let's move further down, guys, to the hands. And this one is super weird. It's called Vanishing fingerprints. And no, I'm not talking about John Doe from the movie Seven, where he pathologically cuts off his own fingerprints. Sorry, spoiler alert. I'm talking about the unsolicited disappearance of your fingerprints. This happened to a patient, we'll call him Mr. S, from Singapore. So Mr. S was traveling from Singapore to the United States. And of course, the US immigration officials held Mr. S at the customs in the airport for 4 hours because they could not detect his fingerprints. Until finally, they realized that he was taking a drug called capecitabine to treat his cancer. Poor Mr. S, he's a cancer patient and he had to explain to the US Customs that he's not John Doe. So whenever we counsel patients taking capecitabine, this is one of the main side effects that we go over with patients, and we've given it a name called hand-foot syndrome. It's a really nasty side effect that can cause a lot of irritation, peeling, and blisters to the palms of the hand or the soles of the feet. And over time, it can get so bad that it actually removes your fingerprints. So from a not leaving any evidence after committing a crime perspective, this might be S tier. But in reality, it's a really nasty side effect and it can really impact a patient's quality of life. And also, this is for cancer treatment, so the patient's already suffering from cancer itself, so I'm gonna put this one in F tier. So we're gonna go down the body a little bit more now to some more private areas. And this is probably the best discovery of a side effect of all time. Not only are we now using this drug for its side effect, it's also making this drug company about $1.8 billion in sales for this drug, making it one of the top 10 drug companies in the world. Can you guess what it is? That's right, it's the side effect of having an erection from the drug Viagra, also known as sildenafil, made by the drug company Pfizer. So in the 90s, sildenafil was a drug first discovered to treat blood pressure. But during the clinical trial stage, doctors soon realized that it's giving another remarkable side effect in men. So of course, Pfizer took this opportunity to rebrand this drug and marketed it for erectile dysfunction instead of treating high blood pressure. And in 1996, it got its FDA approval. And to this day, it's still the most commonly prescribed drug for treating erectile dysfunction, with the side effect of lowering your blood pressure. So I think you'll agree with me that no question, this is going into S tier. Now, something related to this side effect, but entirely opposite in desirability, is called Priapism. It's defined as prolonged and sometimes painful erection. And this can be caused by some pretty commonly used drugs as well. For example, some antidepressants like Prozac, also known as fluoxetine, Zoloft, also known as sertraline, or Wellbutrin, also known as bupropion. There was this one case, we'll call him Mr. M from Massachusetts. He was prescribed an antidepressant called trazodone to treat his depression. And after getting it filled at his pharmacy, he went home and took it that night. The next day he woke up with an erection that lasted the whole day. He didn't understand why, so he didn't do anything about it, and he took a second dose that night as well. And it wasn't until 30 hours later that he finally went to the emergency, and they actually had to do emergency surgery on him. However, it left him permanently impotent. So it's definitely one of the least desirable things you would want to happen. This is going down to F tier. Okay, next weird side effect is urine color changes, and here are some of the common colors and what they represent. You can get fluorescent yellow pee from taking too much vitamin B12. You can get red color from a chemotherapy drug called doxorubicin. You can get blue color from an antidepressant drug called amitriptyline, and you can get green color from a gout medication called indomethacin. Where should I put these ones? I mean, obviously nobody wants them, but they're pretty harmless, so maybe B tier? Okay, I don't know why, but we still haven't moved on from this region of the body. But this is the last one here, I promise. This side effect is sweet pee, to the point where patients would come back and tell me they smell their pee and it smells sweet. And this is caused by a diabetes drug called Jardiance, also known as empagliflozin. And it's because the way this drug works to lower your blood sugar is that it makes your body pee the sugar out. You would think that this is actually a pretty nice or at least harmless side effect, but it's actually not. Because having sugar in the pee means more bacteria can grow there, so it increases the chance of an UTI or urinary tract infection. So without the UTI, this is probably an S or A tier side effect, right? Making your pee smell better and all that. But with the UTI, I'm gonna put it in D tier. All right, last but not least, this one might really weird people out, and it's called oily poop. It might not sound that bad to you when I just say oily poop, but what it really means is the poop becomes so oily, it actually floats on top of the water. And also, people can get oily rectal leakage. Sorry guys, I don't know why I had to make that so descriptive. But all of this is caused by a weight loss drug called Xenical or Orlistat. How this drug works to make you lose weight is it actually prevents your body from absorbing the fat back into your body. So the fat stays with the poop and you poop it out. I don't think this one causes any extra harm, but it does sound really uncomfortable, and apparently it can be really hard to flush it down. We'll end it on the C tier. So those are all the weird side effects I can think of, guys. Let me know in the comments if I missed anything. If you like this video, please don't forget to give it a thumbs up and subscribe for more contents like this, and I'll see you in the next one. Bye!